I do want to move on to our next question, which comes to us from DeJanay. Let's take a look.
As you can see, I struggle with dark marks or hyperpigmentation. It's all over my face. I have it on my left arm. I have it on my right arm. I've been struggling with this since I was 14. I am now 27. I have tried creams, natural remedies, getting facials, taking vitamins, almost everything you can think of. I have tried it. And after I use any kind of product, within a 2-week period, my skin becomes immune to it and it'll stop working. We want to feel beautiful in our skin and confident that we can just walk outside and be ourselves. And that's something that I cannot do. Please, is there anything I can do to clear these marks off of my face and my arms?
DeJanay joins us now via Skype. Welcome.
Hi, DeJanay.
How are you?
So, DeJanay, I think we can sense from your video just how frustrating this has been for you. So obviously you've been dealing with this for years, and you're not alone. In fact, pigmentary discolorations and disorders are the #1 cosmetic condition that people seek treatment for worldwide for their skin. And I think that we see this so much more in people with pigmented and olive-toned skin. In your case, it really looks like you've had some acne, and then what's happened is the inflammation from the acne on your face and your upper arms has then led to this hyperpigmentation from the prior inflammation. So we do see that much more in people who are pigmented, but even very fair people can sometimes have pink blotchy marks wherever they've had acne. And what makes it so frustrating, like you said, is it lasts for months to years. So I know you've tried various and sundry creams. I do think that there is a role in this for prescription strength creams. You can certainly get higher concentrations than what you can buy over the counter. I don't know if you've tried anything like that.
I've tried, I think it was hydrocortisone or hydrocodone. It was a cream that had some kind of bleaching. I tried it when I first started getting it at 14. My dad did take me to the dermatologist, and that's what they prescribed. But again, once my skin got used to it, it stopped working.
Yeah, and that's true, and sometimes you need a variety of active agents. I mean, as you mentioned, hydroquinone is usually the most common one. It inhibits the enzyme that allows you to lay down pigment. We also talk about retinoids that help promote cell turnover. Sometimes people will use cortisone, like you mentioned, though I don't recommend this because over time, whether or not your skin gets used to it, it can certainly thin your skin and make you look more red. Other options actually include chemical peels and lasers, so I'm not sure if you've ever tried anything like that.
I haven't tried laser. I've tried chemical peel. I did it after I tried the microdermabrasion. The microdermabrasion made my skin really, really sensitive. So then I tried a vitamin E and pumpkin chemical peel. It burned a lot, but I didn't try laser.
Well, DeJanay, it sounds like you really need to see an expert, and we have some great news for you because Dr. Vic Ruckel with Lakes Dermatology in your area has agreed to evaluate and treat you free of charge.
I think she's happy.
Yes. And hopefully he can work with you and we can make this better.
Thank you so much. Oh my goodness.
Dr. Batra, it just reiterates how important, #1, if you have a skin condition, so in this case you suspect it was acne, how important it is to treat that in the first place. Inflammatory process, do everything you can to nip it in the bud, because down the line that inflammatory process may create this hyperpigmentation process, which may in some ways be even more difficult to treat.
Absolutely.
DeJanay, best of luck to you. Thanks for asking your question.